Previously on Jspeaks.
Health equity is about ensuring all people, regardless of who they are, their social identities, where they live, their educational status, that they have the opportunity to experience good health. And that's what Healthy People 2000 was seeking to do, but there still were gaps in that. So then as years went on, we had Healthy People 2010, 2020, and now we're moving into Healthy People 2030, and we still haven't realized health equity. We're making changes in policies. We're understanding some of the root causes, which includes racism and systemic oppression. But yet there's still these mindsets of providers, whether in the medical industry or in public health, that don't look at policies to ensure that they're equitable for everybody.
And why is that?
I think a lot of it has to do with lack of knowledge and power and control.
Check out today. What is health equity?
Hello everyone. For those of you who are new to my channel, welcome. And for those of you who are subscribed to Jspeaks, thank you so much and welcome back. As you know, it is my mission, it is my passion to bring to you all conversation topics that are positive, motivational, educational, and informational. Today I am so eager and excited to be here with Maya Jackson. Maya is the executive director and founder of MAAME Incorporated, Mobilizing African American Mothers Through Empowerment. Maya served as a volunteer doula in which she gave support and help to mothers and families along their birthing journey. As a mother of four, Maya has experienced giving birth in both a hospital and a birth center. MAAME was founded through lived experiences and the concerns for her community. She currently serves as a full-spectrum doula, a maternal and infant health advocate, a childbirth educator, and a lactation peer counselor. Please sit back, relax, and most importantly, listen. And hopefully after today's episode, you will become more knowledgeable and aware of the importance of having great prenatal care. So Maya, it is truly a pleasure to be here with you right now. Thank you so much for taking the time out of your day to speak with me. Before we get started in today's interview, I would definitely like to, learn a little bit more about you. Who is Maya Jackson?
Well, thank you for the opportunity. I'm a Durham native. I am Afro-Carolinian, so my family has been in North Carolina or the Carolinas since the 1700s. So I have deep roots here in the Carolinas, and I wouldn't change anything about who I am or where I come from because this is so a part of who I am as a person. I am a mother of five. I have an amazing partner. I am a daughter and a granddaughter of amazing people who've come through some amazing things within this country. And I have been nurtured and loved on by community members. And they have really shaped this path that I've been on over the last couple of years. And I'm a graduate of NCCU, North Carolina Central University, the illustrious North Carolina Central University. Yeah, I'm sorry, I'm not really good at going straight into it, but I have always been a passionate person about other people and helping people all of my life. It's been a part of what I do. And I've worked in a variety of industries over the past couple of years. And that shaped that I was going to be on this road of service and not necessarily working in a for profit sector, but making sure that the work that I did is going to leave behind and inspire other people to make change within the communities that they live in.
Nice, nice, absolutely. So you mentioned in your introduction that you've always been passionate about helping people. What instance in your life, what sparked that, that I guess that gift in you to help? Like, do you remember or recall some time when you were younger? I guess maybe the first time that you did an active service for somebody. What sparked that interest?
Yeah, I think my mother was always a part of in social organizations, so volunteering was just something that was like within her and what we did as a family. I was a Girl Scout.
Okay.
I was probably one of the longest Girl Scouts. I started out as a daisy all the way to a senior in high school. And so that was just always a part of to be mission driven and providing acts of kindness. And I think just the community that I lived in, I would always see other people doing for other people. And so just witnessing those acts of kindness from people who have sometimes little to nothing to give, but just a smile. And for those who have a lot to give financially, it's just really shaped how I feel like we can um, support and care for each other.
Absolutely, absolutely. Well, I'm truly excited to dive into this conversation topic. Thank you for giving a little prelude to what we're going to be speaking about. But diving straight into today's conversation, talking about your wonderful organization, MAAME Incorporated, and also your experience as a doula. But I believe before we can even get into that, I feel as though it's important to talk about what makes your organization important and what makes your role as a doula important, and honing in on the maternal health crisis,
Mhm.
more specifically the Black maternal health crisis. Do you mind sharing a few words about that,
Yeah.
and your insight and your perspective of this crisis that is probably unbeknownst to a lot of people?
Right. The crisis is definitely unknown. And I would say we've been in this crisis for a very, very long time in this country. In fact, America is one of the most developed nations and the most wealthiest of nation has some of the worst maternal health outcomes. In fact, there are developing nations that are starting to have better maternal health outcomes than the US. And a lot of that has stemmed from racism. And so when you create structural barriers from people to getting access to care, the people that you're trying to hurt from receiving the support, you actually have a ripple effect that impacts every single person in this country. And when I say every single person, I'm really talking about the whole family unit. That is the parents that are going through this birthing process. That is the parents of the parents that are going through this birthing process. That is all of the community that is surrounded by these people. Because when one person's life is lost through childbirth, now it's the community that has to take on the responsibility of making sure that that family is able to maintain, but also that they're able to be sustainable through that process. And so, because of these historical inequities, a lot of times people just don't know that people are driving almost 2 hours to receive medical care. Or the reason why they're not able to get access to health insurance, or if they have private pay or Medicaid, why certain prescriptions are able to be paid while others can't. It's all built into this web of classism and capitalism to prevent people from being seen as human and to give them the full quality of life and decency that they deserve. So when I first was pregnant at 26 years old, in the midst of the first recession or the 2008 housing recession, um, even being college educated, it was very difficult finding information and what resources were available. So, you go to community members, you go to families, they say, oh, go to such and such doctor. This will be a great experience for you because this is who everybody goes to. And for me, it wasn't a really great experience. By the time I went to my second appointment, the physician was already trying to set me up for a C-section. I was healthy. At before I got pregnant, I was, a previous college athlete, so I was in the prime health. Didn't have any type of conditions that would present for a physician to prescribe that I needed to have a C-section. At that time, I didn't know that a lot of physicians were presenting elective C-sections for people. I just think through the overall experience of care, um, it wasn't what I desired. And so I had to spend a lot of time educating myself outside of medical spaces. It was hard getting support and resources. As a recent college grad, the recession is happening. Everyone's looking for employment. It was difficult finding employment. I had to move back home with family, and it was just very challenging. And then there are the cultural pieces of the challenges that we face. Most of the women in my family did not have a natural birth. They didn't breastfeed. I didn't really know a lot of it. So there wasn't anyone within my household that could teach me about certain things. Yes, they can teach me how to parent, but the things that I desired in my own journey in parenthood, that information was lost. And a lot of that information was lost because once Black people moved into urban areas due to migration and going through Jim Crow, people started to look at midwives and natural birth as something that was um, behind the times. To whereas if you're in the hospital and you're birthing with the physician, modern medicine is the key to everything. Not realizing that you are also not receiving the same equality and access of care. And so what we've seen generations of families not breastfeeding, in which we know that breastfeeding initiation is the best source of milk for any human child. And we can see how the impact and development hits our children early on when there's no formula when there's no breast milk for them and they have to go into formula. We've seen the impact of the lack of care through postpartum with a lot of our families because people don't know they need to rest for 40 days. And we have been pushed into resting for 6 weeks. And if you have a C-section, you're pushed to stay for 12 weeks and then you're supposed to go back to work as if everything is okay with your body. Whereas in Europe, they have deemed postpartum care and recovery a whole year.
Oh, wow.
And what's included in that whole year is benefits for not only the birthing person, but for their partner. So that way they can also rest as well and get a better quality of care in life. And so, with all of the structural things that have been tacked upon the system for people receiving care, um, yeah, that ripple effect I was telling you about, it has made it very difficult. And I didn't know it when I became a first-time mom, but I started to see it after. Like I said, I'm a mom of five. My first birthing experience at the hospital was very traumatic. I told them that I didn't want any residents in the room. I didn't want any strangers. I wanted to push the way that I wanted to push. And I just remember pushing, and there was people in white coats. So I didn't give consent for them to be in my space, but they showed up. And even before I started pushing, I could just hear the nurses talking about me as I was laboring on the floor. So instead of supporting and championing me through this process, now a spectacle on the floor because they had never seen anyone walk while they were in labor, which was really odd because you're being trained to support people through birth. And here someone's going through the birth, but you're just gawking and conversing instead of supporting through this process. And within that process, I just felt like through all that chaos, I was forgotten about because after I had my daughter, the nurses forgot about me for hours and I did not know that I was hemorrhaging. Thankfully, I was not hemorrhaging to the point that I needed a transfusion. But the fact that I had to keep repeatedly calling someone to come in to see what was going on, and I didn't know that I was hemorrhaging, that was eye opening. And then as I talked to my friends, as we became older through our own lifespan and other people becoming parents, you kind of hear this shared story of not being seen, not being heard, mistreatment, misinformation,
Mm.
and not feeling like you actually have agency or choice in your body. So it's definitely been a journey in how this has shaped MAAME. MAAME, I think, has definitely been shaped by the lived experience, not just of myself, but my entire community. Because if you go online, there's thousands of women in this country, probably hundreds of thousands to be honest, talking about the same thing, but with different experiences.
Interesting. So, going back to um, that example that you were talking about, like your community and you trying to, uh, what's the word? Um, Trying to find information on giving birth and how to go about it. Do you believe that the communities, like our communities, the effectiveness of our support is dwindled because we don't have any resources or we lack resources? For example, like you said that you couldn't talk to your family or your mother about what you were going through because they did not know or they did not know how to approach that. Now I'm just thinking of a wider scale. You know, the Black community I say as a whole,
Yeah.
but you know, larger. Um, you know, if nobody knows how to um, go about helping their daughters go through, you know, their pregnancy journey, um, that community aspect, do you think well, yeah.
I think our community is very strong in a lot of things, right?
Mhm.
I think when we think about birth, there's just generations that just miss that opportunity to experience what communal birthing looks like.
Okay.
And so when it's been systematized, the only information resource they can have is the process and experience they went through, which is you go to the doctor, you go to the hospital, you have the baby, you give them formula, and you go back to work.
Mhm.
Whereas in other cultures within the African diaspora, is you go through this pregnancy, you take care of yourself. Yes, you go to the doctor, you have the baby, but you rest and you rest for 40 days. And we come in and we take care of you. The focus is not more so on the baby, but we come take care of you so that way when you are healed, then you are able to take care of the baby. I think because our country or our community has been so assimilated into uh, individualism. I think a lot of times when it comes to caring for Black birthing people within our community, the excitement and the joy and the attention is always on the baby, but never the vessel, the person that's carrying the baby. And so a lot of times when there are complications, where there are signs of distress, it gets dismissed. It gets dismissed as if, oh, this is just normal pregnancy. Or, oh, well, if your doctor said this, then you need to trust your doctor. Versus, it's okay to get a second opinion. If your body hurts, it's aching, something's not right, you have the rights and the freedoms to seek help someplace else. Even having a conversation that people have options is not on the table. And so I think we have resources, but not enough resources to help people navigate the choice and what they want to do with their care, particularly when they're going through pregnancy and postpartum.
Now, through your organization, have you seen, I guess, resources being more accepted through the community?
I think yes. I think what we do with us providing the education,
Mhm.
and not education saying that people are uneducated, but our education style is making sure that people know that these resources exist.
Mhm.
Because a lot of times the resources that are set up through government programs are very restrictive. It doesn't mean that someone who is in the upper working class or middle class doesn't need help and support services, because they equally need help.
Mhm.
I like to tell people that a lot of these households are one flat tire away or one financial disaster away from being placed in poverty. So when we place these very restrictive barriers on folks, people don't know how to navigate it. And then when they go try to seek help, they're either shamed for asking help, or they're told no based off of 1 cent that's sitting there, on their check stub. And so I think what we do is to really empower and educate people on how to find the resources that best meet their household. But we also work from a sliding scale. And so we want to make sure that we meet people where they are. So whereas, a lot of government institutions will say, oh, you make X amount of dollars, you're receiving this, you can't get help. We're like, no, you can get help, but let's figure out what this support looks like, because every individual has their own unique situation. And I think the way that we've designed the program by listening to the community members and what they need, we don't create anything unless community is open or wants to receive it.
Interesting. So, through your experience, why do people steer away from asking for help?
I
Because I
think,
feel as though we can't live in a vacuum. We
yeah.
need each other. So it's okay to not know. It's okay to inquire. But why would asking for help deter someone from, approaching you or
Mhm.
approaching your organization?
I think our community has been socialized that we don't need each other. And when you remove community from people who are inherently ancestral backgrounds are communal,
Hmm.
people don't know what that looks like. So when I grew up, I knew the teachers that taught, my aunts and uncles, and my parents, the pastors, the police officers, like you knew everybody by name. And somehow, as generations and time has gone by, we're like, we don't need you, right? People don't want to take advice. People don't want to be told certain things. People don't want to get advice about their parenting. People are setting boundaries, and boundaries are good. You want to make sure that you are receiving support. You want to make sure that people respect your belief systems and your practices, which is great. But I also think that we have to find some type of common ground so that way we're not setting up so many boundaries that when you need help, that there's no one there at the table. Because the government is not going to help you. These institutions are not going to help you. So at the end of the day, particularly if you don't have family, community is all you have. And for a lot of people, their friend networks is their community. And so people have to start finding a way how to nurture those relationships so to ensure that in a time of need, they don't feel like the door is going to be closed or that it's a difficult pathway to navigate that.
Okay. So switching gears a little bit, not too much, but you touched upon this in one of your answers. I can't re-say it off the top of my head, but I'd like to talk a little bit about this. What do you believe are the contributing factors to maternal mortality? Um, you said like lack of care, lack of attention. You
Right.
listed that. But if you can go into a little bit more depth and more specifically, because I know that I have friends who want to know this question as
Mhm.
well too. Do you also believe that age is a contributing factor?
No, it's racism. All of it's racism. There's no way that you can look at Black birthing people and say that there's something inherently wrong that that person has done, right? If you think about how we were brought to this country and the legacy and the time frame that we have literally been working nonstop since we've been here. So that if you think about epigenetics, and that is being the fact that based off of the time frame that you were brought in this world, the person that brought you here, you were already experiencing the trauma and the stresses that they were dealing with. So that's my mother, her mother's mother, and her mother's mother. So by the time we've been here, like I said, my family's been here from the 1700s, my body has already been impacted by that trauma. And then based off of where you live, based off of your circumstances after those generations, based off your designation, your zip code can determine what that time frame is going to be for you. Some people don't have access to clinics in their community. Some people don't have access to grocery stores. Some people don't have access to proper schools in which they can get a quality education. So these structural things along the way is the reason why there is a crisis. There are not enough Black OBGYNs. There are not enough Black midwives because systemically they removed Black midwives from the South in the 40s, which really started the ripple effect. When you remove the care unit and the providers from the community, you then remove access from people to having care. And when you corporatize healthcare and you are looking at it from a profit standpoint versus caring for people, when it's about the numbers, then you really aren't thinking about people at all. In the city that I live in, we are here, one of the top major health systems at Duke University. Even me making a primary care appointment it's 3 or 4 months out before I can even be assigned a doctor. So imagine if you were pregnant and in a state that has restrictive abortion laws. Let's just say you have a medical emergency, you need to make a decision. Who can you see in a timely manner to get access to care to make a decision about your body when the system is set up for you to fail?
Well said. So our history and so our history of just not being taken seriously.
I would say it's our history of being historically excluded.
Historically excluded.
Mhm.
Now, do you believe that there are any underlying health conditions also when it comes to um, maternal deaths?
I
Or at
think
least
that
within our community, is there anything
for the most part, no, because they're preventable.
true?
All of the diseases or the incidents in which Black women are dying, whether during birth or postpartum, are preventable. A lot of these things aren't even showing up for people when they weren't pregnant. So these things are happening in the midst of care because they're being overlooked by the care providers that are caring for them. And that is why we have seen this increased rate. You think about Beyonce, Serena Williams, Tatiana Ali. These are very famous and wealthy Black women who have all had these negative experiences with birth, and people didn't even listen to them. Beyonce and Serena are billionaires,
Hmm.
and people didn't, they almost died during childbirth. So imagine what it's like for someone who's not in the 1% and the experiences and the struggles that they're dealing with just getting seen around court issues that they're having that could be life or death.
Now, if healthcare is all about making money, why just focus on one race? Like if you want to make a lot of money, why focus on just, white, black, Hispanic, and so on and so forth? Why are we focusing on us black people?
Can you explain how?
Um, okay, so you said that um, the healthcare system is more so about making money
Mhm,
versus giving care to the patients.
mhm.
And as far as we are concerned, it has been directly impacting our community. They're exploiting our community. So, from a capitalistic standpoint, wouldn't you make more money if you exploit multiple communities instead of just one community?
I mean, well, that's the ripple effect. The foundation is us.
Oh,
So
so we're the
they're the
foundation.
foundation.
We're not just the, okay,
No, we are the foundation, but we have the worst outcomes because how the system sees us.
how the system sees us. Okay.
Right. So the issues that we have as Black women in maternal health, Indigenous women have similar negative outcomes.
Mhm.
Hispanic women are now on the rise with those outcomes. White women are having these issues, even though they're not high. Those experiences of not being seen and heard is happening to every birthing person in this country, similar to the abortion laws. You're trying to punish a group of people in this country from having choice and agency over their bodies. People are now being placed in prison. They're going to jail over a miscarriage, not an abortion, but a miscarriage. So it is the entire country now that is being penalized through this system of oppression that started with us as the foundation that's now impacting everybody across the US.
Wow. So, with black people number one, would number two be Hispanic and
Yeah, black women
black women?
and indigenous women have similar maternal health outcomes because of population size. Black women are much larger, but Hispanic women are on the rise. And one of the things that we see with our Hispanic communities is that if they are the other, Hispanic and indigenous, Hispanic and black, their outcomes start to mimic Black women's maternal health outcomes.
Interesting. Could you talk a little bit more about that?
Well, it goes back to racism, and this is why I will always lead that racism is the root cause of this. Because if you are Hispanic and white presenting, your treatment and your access to care and your access to respect, also if you're Hispanic, white presenting, and speak English,
Mhm.
you're going to be treated as a white woman. If you're Hispanic you are Black presenting, Indigenous presenting, and you are more fluent in Spanish than a than a white presenting Hispanic person, you get treated like a regular Black and brown person here in this country. I've had clients who have explained to me how their treatment was from the nurses. Very educated woman talked about how she fully understood what the nurse was saying, and she just felt like she was not being seen or heard. Um, a lot of times, the stereotypes that is perceived of Black and brown people plays a lot into that. Um, and it's unfortunate because, again, you're dehumanizing people when you're supposed to be caring for that person. And that is why you start to see this very much so a ripple effect of decline in a lot of communities at birth, is because it's the same copy and paste treatment of care that's been given to people.
So if you see that this is if you see that this is detrimental to our society, or as detrimental to America as a whole,
Mhm.
I'm sure the powers that be see it as well, like the government, these hospitals, these large hospitals. Why are we not stopping? Like, are we just going to continue down this road until we just have a crazy high number of deaths across the board? Like, when is it going to stop? I know you probably don't know
Yeah,
the answer, but it's just like, okay, we're seeing
yeah.
patterns. We're moving in this direction. It's getting very bloody.
Mhm.
When are we going to
I
halt
don't know
this?
when it's going to stop. And this is why supporting community-based organizations are so important,
Absolutely.
because we're not tied into the bureaucracy, the politics, the religious beliefs. Our sole purpose is to see people as human beings and to care for them. And a lot of times people think, um, that the government is just one day going to transform. We're talking about 400 years of rooted racism, systems of oppression that has not changed. I don't know how old you are. I'm 41. We've seen this road so many times, time and time again. And this is why community organizations are so important, because when these institutions are not working, when they are failing us, it's community that has to come together and figure out how to take care of each other. And that's really at the heart of what we do with MAAME. During the formula crisis about 2 years ago, we only had 4 formula manufacturers in the US to serve all of these people, all of these babies. And this wasn't the first time these formula companies had issues with manufacturing. I mean, bugs, glass, plastic, bacteria, all of these things were contributing to deaths of children in this country. And the government regulated only 4 factories to exist. It was almost like a monopoly. So when all of those factories just stop working and you have babies who need to be fed, and you're not promoting lactation in any of the communities because you want women to go back to work, you're not providing families with paternity leave, maternity leave that's long enough for like a well-balanced rest and quality of life, again, it's just creating a ripple effect of issues that are plaguing our society.
If you made it this far into today's episode, thank you so much for watching. And wow, what an episode it has been so far. I hope Maya's explanation on the maternal health crisis gives you a glimpse into the world that women live in and a better understanding as to why this topic is so important. Please don't forget to like, comment, and subscribe, and I'll see you at the end of this commercial break.
This costs over $2,000, but honestly, it'd be worthless if I didn't know how to use it. See, as great as your gear may be, it'll only be effective if you are educated on how to use it. That's the whole reason I started my film course, Film Foundations. It's only $45, and it's an e-course that's going to teach you the basic concepts in filmmaking and videography. So regardless of whether you want to start videography as a business or a hobby, or even jump into content creation, this is the course for you. It's going to give you a lot of those starter concepts when it comes to filmmaking. So you can purchase my course for only $45 at www.anointedmedia.group. Thanks for watching.
So please go into a little bit more detail about, your role within MAAME,
Mhm.
the history behind MAAME, and even the name
Yeah,
MAAME. Please take this opportunity
sure.
to share on that.
Great. So MAAME is an Akan word. Akan is an ethnic group in Ghana. So it's a Ghanaian word. And I grew up, my dad's eldest brother, one of my favorite uncles, was a professor and spent a lot of time in Ghana between the 60s and pretty much all of my life. So, very much in educating us about our history and community and who we are, where we come from. And that really shaped, like I said, my community has shaped a lot about me. And so that was to pay honor to him and the work that he did. He used to have me in cultural schools on Saturdays as a kid, and I couldn't enjoy it because I was like, I'm the only kid in here. But I saw how powerful that experience was to be in communal spaces with people who were learning and sharing information and knowledge with each other. And so, yeah, that's like one part of how Mame became to be in name. I have a really good friend named Dr. Treva Lindsay. She's a feminist thought leader and writer at the University of Ohio. And she kind of helped me put all of the acronyms and stuff together because I'm not that creative when it comes to creating stuff. And so between Triva and my uncle, I was like, this is what the organization is going to be. And it's just like my lived experience. Like I said before, today is the anniversary of my mother's birthday, who transitioned in 2012. She died of breast cancer. And I remember being a young mom. I had my second child at that time, and the company that I worked for only wanted to give me 2 days grief. And for us colored folks, 2 days is disrespectful. We need time. It wasn't even like a week to just kind of like decompress. And I was with my mother when she transitioned. So imagine being with the person that birthed you in this world, and you're now the person that's there with you, there with them while they're transitioning. And so, it was hard. It was a traumatic experience. And I just remember listening to my manager tell me that, you only get 2 days. And I was like, you know what? Let me just pack my stuff up. And I just started. I was at my desk and I was just packing things together. I said, this is my last day. I didn't know what I was going to do. I had no idea where I was going. And I remember I had volunteered at a community health fair. And at this health fair, it's an organization in Durham called Healing with Care. And I didn't even know the director at that time, but I was just so amazed. It was 800 people outside who needed access to dental care, vision care, medical care, food, just tons of resources. And I was just so inspired by the work that Dr. Bynum had done at that time. And when I met her, she was like, I know you. I was like, you do? She said, I know your mama. And I was like, you did? She's like, yeah, we were in nursing school together. And she knew that my mom had passed. And I just told her how the job was. And she was like, well, I got a desk if you want to come in. I was like, well, what am I going to do? She was like, well, you're young. You'll figure out what you need to do while you're here in this space. And so watching these women in community treat people who were struggling with HIV and AIDS and substance abuse and mental health conditions with little to no resources to really impact an entire city with limited resources for the Black community was like the starting point of what I wanted MAAME to be. And at that time, I didn't know I was going to create MAAME. I had asked her because I thought I was going to be there for a while. So Dr. Bynum said, why don't you have programs for women and children? And she was like, well, that's not for me. That's for you to do. I was like, oh. And time had went by, I think almost 6 years from the time that I was there. Um, I eventually had my fourth child at the birth center, which is a very empowering experience. And I was like, I want to become a doula because I want to help people. And at that training, I was like, I'm going to start a nonprofit. And I played around with the idea. And I remember I was like, if I'm going to do it, I need to do it now. I filled out the paperwork. MAAME came to be. And in 2019, we trained 20 Black and brown doulas across the triangle to service the community. And at that time, I didn't know that we were going to grow to be what we are now. In the fall of 2019, one of the local housing communities had 3 babies die back to back um, due to some unknown incident that no one wanted to acknowledge. But the community members were on Facebook showing dilapidated housing. They had gas leaks for months, brown water coming out of the walls, plaster. So we were invited to come in just to kind of hear the stories. And we were just going to come in, to provide what resources we had. Little did we know in 2020, January 2020, that the whole complex was getting shut down. And I think they said between 300 to 600 people got moved to various hotels across the city because the community was neglected. So here is public housing, which is federally funded, which is under resourcing the community that was built to provide substantial housing for the community. And that was really a sign that though government is here, we cannot depend on government anymore to help solve and fix problems. Already before that community was impacted with that disaster, there was cases of lead, which we know has impact on children, hypertension, diabetes, all of these different things that were going on from a public health standpoint in this community, and no one was paying attention. And when the crisis hit, the community was like, we need help. And everybody turned a blind eye. And so the community leaders got together and started organizing the logistics to make sure that their folks were taken care of. So our role there was to help provide resources to food and essential baby items. And that's how our community giving closet got started. We wanted to make sure that the families did not have to struggle during the transition for resources. We also wanted to make sure that families who were prepared to birth had support and knew how to navigate those resources. So we would do house visits, wellness visits and checks like that. And then COVID hit. And when COVID hit, we weren't allowed to be in the hospital because at that time, the health systems didn't know how to navigate a very deadly disease and how people were going to move and provide care. But it didn't mean that people didn't need access to support while being pregnant. And so we switched to virtual support, but we're still on the ground providing mutual aid and resources to families across the triangle. And from there, we eventually became to be in the space that we have now. So it's been a beautiful journey to see how little seeds have been planted along the way and how we've grown to be able to support people and do more.
Wow, wonderful story. That's very powerful, and still keeping that same love for your community that started so young and still to this day. You mentioned in your explanation a birthing center, and your face lit up. I don't know if too many people know the difference between a hospital and a birthing center. I'm asking for myself
Yeah.
as well as my audience. So if you could please talk about that. What is the difference between, giving birth in a hospital versus giving birth in a birthing center?
Yeah, so birthing in a hospital is highly medicalized. So there are systems and processes that are there to support families who are having highly medicalized births. Sometimes you can be a low risk birth and be in the hospital, which is fine. I'm not anti birthing in a hospital. So I really want to make sure that's clear because I think a lot of perceptions is that doulas, don't want providers there or don't want to be in the hospital. People need to be in the hospital. The hospital serves a major purpose, right? The people that are in the hospital are highly skilled and trained to deal with major medical issues. And being that birth is a major medical issue, for high risk births, it's very important for people to go into the hospital and get the care that they needed. For me, I've always had low risk birth. My first birth that I had, I was walking around at 10 centimeters. And 10 centimeters is typically the time frame that you are getting ready to push. But I was still walking around and I was fine. But they had all the monitors and all the bells and whistles, and it was just a lot. It was overwhelming. It was what I like to say, it was a sensory overload for me in that space. Also, having people come in and out, um, sometimes just as a routine, but not necessarily a necessity. And when it was a necessity, no one was coming in. So the environment was not the environment that was best suited for me, as someone who barely wanted any medication, barely wanted to be bothered or touched. Birthing at a birthing center allowed me to be with clinical providers who are certified nurse midwives who are able to support vaginal and natural vaginal births with minimal to no disruption. So as I was laboring, I didn't have people coming in every, 20 minutes bothering to see if it was okay, because they know the body is going to do what it's supposed to do. I was able to eat. So if you're pregnant and you plan on birthing in a hospital, you can't eat. Now your body is going through full physical exertion and you can't eat while you're there. They're mainly telling you you can't eat because in the event that something happens, you have to have a C-section. You don't want to have food in the system, which makes sense. But if you are a low risk birth, I need all the endurance that I can. Your body is like a marathon when you're laboring. So you don't have any protein and carbohydrates to this process, you're going to get very tired. You're going to get very sluggish. So for me, I just wanted to have a birth with ease. I wanted peace and quiet. I wanted to be left alone. And I wanted support when the timing was right. And that's what the birth center allowed. But it also created the opportunity for my family to experience the birth. So my children were able to be in the space with the midwives. They were able to check the stethoscope to hear the baby. It was a very hands-on experience and not just doing a routine to be doing a routine. That was the big difference for me. Is just the type of experience and the environment that I wanted to have my babies in.
So to me, correct me if I'm wrong, it sounds like a birth center is like giving birth at home,
Yep.
but not at home.
Right. It's exactly like that.
Okay.
And the beautiful thing with the center that I went to, they have a close relationship with one of the local hospitals. So in the event that something went wrong, I would get transferred, but still receive the care from the people that were providing me with the care. When you are at a traditional OBGYN practice, a lot of times you don't know who's going to be there with you the day that you give birth. So it might be a physician that you just don't like that's going to be there, which can really create anxiety and stress, which can, derail or have a negative impact on how that birthing experience is going to be for that person.
Interesting. And it affects the experience, or does it affect the baby?
It affects the experience, which could affect the baby. You have to think
Wow.
about the mood of that birthing person in that space. So if they haven't had positive interactions with that provider, and it is that provider that's there the day that they're giving birth, it could change how that person is going to birth during that process. And especially not only the provider in the hospital, but that family is also dealing with the entire staff. So that's the nurses and everybody that's coming in and out. It can be a lot. It can be very overwhelming.
Okay. Now I really want to get into this next question. You've mentioned doulas in your explanations. You've mentioned midwives, but I'm not sure if everybody knows the definition or the responsibilities of a midwife or a doula. If you don't mind, could you go into that?
Yeah.
What are the roles of a doula? What are the roles of a midwife? How are they different? How are they similar? Um, yeah, because just leading up to this interview, I'm talking to family, talking to friends, doulas, midwives. People are like, huh?
Yeah.
So, especially within the Black community,
Mhm.
if anybody knows about doulas or midwives, it's in the Black community. But outside of the Black community, it might be a little um,
So,
not so familiar.
doulas, we are non-clinical support people, meaning we are not prescribing medication. We are not subscribing any ailments or anything that's going on with them. That is left up to their medical provider. And I really want to stress that because I think a lot of times when people are referencing doula support to their friends or loved ones, that's where the confusion kicks in. So we are non-clinical support people. We have clinical knowledge and understanding to guide and navigate our clients through their prenatal and postpartum journey, but we are not responsible for the medical care or the medical outcomes of that birthing individual. So our support is informational. So we provide them with resources to make informed decisions about their care. So that could be childbirth education, that could be any type of evidence-based articles, or referring them to evidence-based practitioner for more higher level support. We provide them with emotional support because pregnancy is very hard and postpartum is very hard on the body. So if you're thinking about how that person is going through a lot of hormonal changes, and let's just say that person doesn't have adequate support at home or adequate support in the community, it can be very hard on the body to go through pregnancy and not have people to turn to. And so we are there with an unbiased ear. This is a judgment-free practice that we support people. We're also there physically. So when someone's having birth, the worst thing for us is to see someone laying on their backs giving birth, because we know it's going to be a difficult labor. And that type of position was designed by a man. And so for us, we're like, nope, we're going to get up, we're going to walk around, we're going to do some squats. We got to get this baby down. And this can be done whether the person is having a vaginal birth, whether they have an epidural and they're stationed to the bed, we're still going to move them while they're in the bed. But this can also be done, with providing the emotional and physical support during a C-section, because I've been with families who've had to have C-sections for medical reasons. And then we are also just there just to be resource navigators. In my work, when my clients are having high level medical concerns about things that they felt like their providers weren't able to give them the answer to, I utilize my network of practitioners and providers that can help them discern the information so that way they can make an informed decision about their care. Because again, we've been a lot of times conditioned that we don't have any other options. So people don't think that you can transfer a medical practice within the midst of your pregnancy. People don't know, if you don't like this hospital while you're in labor, you can go to another hospital.
Oh, wow.
So people have choice. And so that's the biggest thing, is for us to empower people, but also to really empower and support the families, because a lot of times the partners and the support people are forgotten about. They need just as much as education as the person that is giving birth, because they're the ones that are going to be in the home supporting that person. And I love when I see family members participate in the meetings, so that way they're just equally prepared to be there in a nurturing way. And I always want to make sure that our family support people know how to support the person based off of their needs and desires, based off of what they want to do. With a midwife, there are different types of midwives. There's a traditional midwives who just been in the communities for years practicing births. That would be no different than a traditional midwife in a developed nation who's been attending births for years. They just don't have a an accredited certification, right? Then there are certified professional midwives. These are midwives who've gone through midwifery school and midwifery training, but they're not at the higher clinical level of a certified nurse midwife. And then there's certified nurse midwives who actually went to nursing school. They've gotten their nursing degrees, and then they went to graduate school to get their master's degrees to become a certified midwife. And they have similar scope of practice as a physician outside of surgery. And so that's really what the bigger difference is between that diverse group of all of these practitioners. Depending on depending on what state you're in, the laws vary depending on who can do what based off of their scope. Sometimes in some states, the CPMs have more freedom and flexibilities, whereas like in North Carolina, CNMs have more freedom and flexibilities to do this work. In fact, CPMs can't even legally practice here in North Carolina.
Interesting. So a couple questions just from that response. First thing, I don't want to assume anything. Are doulas typically women, or can they be men?
They can be men. It's a growing number of men doulas
Why do you believe that that's the case?
because they find the need to support partners, dads. In fact, there's a
Okay.
gentleman, I think his business name is the Doula Dad. And because they're coming in from a different perspective and lived experience that needs to be centered. I think a lot of times when these incidents of maternal morbidity occur, people don't remember that it's, particularly if you are in a heterosexual relationship, it's that father that's left. And men in our society have been conditioned not to be the emotional support person in the room. They've just been taught to be the provider. So a lot of times there are disconnect of what support looks like for your partner through pregnancy. Some of them don't even think they need to be in the room, right? Because traditionally, men have been pushed out of the room when they used to be in the room. Birth used to be such a communal thing. And then as we've monetized it and systematized it, it's less people who need to be in the space that have been permitted out of the space. Now they're allowed to be there, but the education that they need to feel empowered and to be supportive partners a lot of time is missing. And so I'll see sometimes with our fathers, they don't realize what postpartum care looks like. They don't realize that she's not cranky just to be mean, but that her body is, there's something hormonal that's going on and changing and shifting, and that you have to then adapt to how to support them in this process. And so you see a lot of times relationships kind of start cracking once the baby comes home. Sometimes you will see men that think that it is only my role to do this and your role to do that, where from a communal standpoint, everybody chips in. So there are a lot of men now getting in the field who are showing how to positively support families, but also so that the dads have the education and knowledge to be fully present during that recovery stage. And there's one dad on TikTok, this young Black man, who has been promoting breastfeeding in the community, which is really amazing. He shows how to prepare the bottles and what the lactation process is. So it's just been a very transformative to see how men are now seeing themselves in this space.
Wow, thank you for your response. I do want to touch on another point too. You talked about the education necessary in order to be a midwife. For a doula, I don't think you talked too much about that. So what's the education or what's the training
Right.
that goes into, like, if somebody, if one of my viewers wanted to, is interested in being a doula, what would they have to do?
So there is a formal training process that anyone can go through. Now, keep in mind there are tons of, not tons, I would say different types of doulas. So there's birth, there's postpartum, there's full spectrum, there's death, there's sex. Pretty much any lane that people feel like they want to be in the profession of supporting other people, there's a lane for it in the doula space. In regards to the birth side, there's tons of organizations across the country. You just have to figure out which organization's core values suit you the best and what your pathway is in this work. If you are looking to be a traditional doula that's not doing community work, then the traditional organizations, I think the average training for them is about 16 hours, and then you have to actually provide practical skills showing that you support people in the hospital, in the home, and then you have to get your certification written off by the client and the providers that you're working with. On the community-based side, it's much more different because we are focusing on the public health crisis as well as social determinants of health. So people who come through the training of our organization go through about 60 hours of training and education, and then they get practical skills and apprenticeship in the field through the work that they do with us.
Wow, thank you. Yeah, that makes sense. That definitely makes sense. So when it comes to having great prenatal care, do you believe, not Google, do you believe that it is necessary for a family to, or a mother or wife, to have both a doula or and a midwife, one of the two?
I think it's important based off of that individual's medical history to figure out which clinical provider is going to be best for them. Some people will need a OBGYN, some people will need a midwife, but definitely at the core of all of that having a doula to support them along the way is key. Um, and I would try to explain to a lot of families, the sooner the better. So as soon as you find out that you are pregnant, start getting the support, find a doula. And if you can't navigate which provider would be best for you, then your doula will help you kind of figure out what options you have within your own community to see if a midwife or a physician, OBGYN, would be best for that individual. But definitely start with whatever that individual's medical needs are, clinical needs through the pregnancy. For me, I was low risk. I didn't need to go through all the traditional bells and whistles as someone who was high risk. So for me, if I would have known that I had options in the beginning, I would have gone with a midwife.
Okay. Okay. Thank you for that. So we discussed, third party help and support um, when it during a woman's birthing journey, with doulas and midwives, and the importance of that type of intimate care. Um, Now let's focus on the person, the woman. What could a woman do within her own means to prevent maternal death or prevent a hiccup in the birthing process?
I think it's best for the individual to understand that they are going to only give you so much information that they have been trained to provide you with. And so for me, it was really important to seek more knowledge, but seek knowledge that wasn't on social media, but seek a knowledge from lived experiences, but also that was evidence-based. I did a lot of research. My last birth that I had, I birthed at home. I did not have, because our birth center closed down, I couldn't go back to it. And I had to go through the traditional pathway of care through medical practice, and it wasn't great care at all. I came down with COVID and I was forgotten about. I tried to get support, and even with trying to get another appointment in, it was so many weeks out from my due date, which was literally around the corner. I'm like, are you guys not looking at my chart to see like what's happening here? And so because of my knowledge and understanding of the birthing process, as well as just knowing, health professionals in the field, I was able to find a certified nurse midwife to support me, and I birthed at home. And so because we know that the system is broken, we have to go around the system to ensure that it's working for us. And when it doesn't work for us, then people need to know that they have a choice, and they need to utilize that time frame of choice that they have to ensure that they're still receiving the quality of care that they need um, to hopefully have a healthy outcome.
So speaking of choice, do you believe that there's like peer pressure within the system?
No, I don't think it's peer pressure in the system. I think that the system is so unaware with how broken it is. When I talk to physicians a lot of time about the things that we see, they are completely unaware of the challenges that their clients are facing. So, just about all the health clinics that we can think about, a lot of times the physicians don't even know that their clients are waiting, weeks to get an appointment. Yeah.
Wow. Um, and I still want to, you brought up COVID.
Mhm.
I don't want to pass that word by. How do you believe that COVID has impacted, hospital practices, the system, maternal deaths, you know, before and after COVID?
Mhm.
Like the good practices before COVID, are they still good? Have they worsened? Have the bad practices before COVID
Mhm.
improved? Is there more focus, within the healthcare space with COVID? Like,
I think I can only speak about my experiences because everyone's experience is different through this process. Before COVID, it was a benefit allowing people to be in the room during the birth. During COVID, when they started limiting people being in the room, that was a lot for people. We were receiving phone calls from families in Oakland and in Dallas because they have loved ones here and they can't get to them. And unfortunately, we weren't able to get to them either because we weren't allowed to be in the room with them.
Mhm.
So a lot of people had to birth by themselves, and that's very scary. And to not know if the nurse that you have during that shift is going to be pleasant or the doctor is going to be accommodating and listen to you, it's a lot. So I'm sure there were a lot of traumatic births during that period of time. When the hospitals let up, we were allowed to be in the room, but they cut our time frame down very quick. So before we could be there for the birth and we could be there postpartum, they were kicking us out right after the baby came out.
Wow.
So that wasn't even enough time to make sure that our families were recovering well, that they had lactation support. Another systems issue is there are not enough IBCLCs. And because the system has stated that you can't be an IBCLC, which is an international certified lactation consultant, a lot of health systems will say, well, since you're not a nurse, your certification that you went through to be a healthcare professional doesn't matter. So you can't work in our facility. Most hospitals don't have enough lactation consultants that can accommodate every patient on the floor. And so a lot of our families struggle with initiation, and we had to call them out because of it. Also, I dealt with experience of racism depending on like the rural parts that I went to service families. I remember I had one client who was, she hadn't birthed in a while, so it was her first baby in 13 years, it was a very long time. And she was in the room with her partner, and her partner was just not emotionally equipped. It was overwhelming for him. And I could hear that it was overwhelming from him because he would text and he would call. He's like, what am I supposed to do? Because they just left him in the triage room together. And I remember going to the desk and I said, hey, my clients, they're not doing well. Partner seems very stressed. Can I go in to support his partner? And the nurse was like, no, because of COVID. Mind you, this is rural North Carolina, Johnson County. This is probably like 2 a.m. in the morning, COVID restrictions. There's nobody in the hospital. There's no one in the break room. There's no one in the lobby. There's no one in the floor. And I'm outside sleeping in the cold, waiting to be called to come in to support the family. And so I think that COVID created opportunities for people who are bad apples in the industry to get away with more, right? But I will say that with the work that we do as an organization, I see providers who want to change, even though the systems that they exist in can't change, but they are changing the way that they are working and supporting families. We've had quite a few physicians come and intern with us as they're getting more degrees on top of degrees. We work in a lot of spaces around equitable research in healthcare, particularly for Black and Brown birthing people. And so there is some growth of improvement with the individual, but system-wise, we're not there quite yet.
Wow. So this is actually going to be my last question. And just listening to your response, what do you believe needs to change institutionally with the healthcare system, in order to prevent maternal deaths? Like if you had a magic wand and you could change up how things are run today, what would you do? And you didn't have to ask anybody for
Yeah.
any type of permission, what would you do?
I think the type of care and access has to be leveled out across the board, right? When you create a system in which certain people can have access based off of race and class or their insurance, like they used to do back in the day, and they probably still do it. If you have private insurance, everything is golden sometimes. If you have Medicaid, there are providers that won't even take Medicaid. So a lot of people are just struggling to like navigate what's even available to them. So I think leveling it out all the way to the floor to ensure that client A and client B, no matter what their circumstances are, the level of access and care and resources are the same. I truly believe that if healthcare is going to be a business, you want to make sure that you have good, happy, quality customers,
Absolutely.
right? Because we're humans. We're going to have to keep seeking care. No matter if we are 100% healthy, people still need checkups, right? People still need screenings and evaluation. People still need medication. But the more that we kind of put this tax on profit over people, that model does not work for any of us when, as one of the wealthiest and richest nations, in the developed nation, the developed world, our health outcomes are trash, right? Europe's and some countries in the Middle East have better health services, more accessible services than our own country. Like, a lot of people are into medical traveling for dental and all these other reasons. That's money lost. Like, if the gain is money, we're losing money because people are finding better alternatives to care at a fraction of the cost, even sometimes lower the cost. And so I think we just have to reshape and reframe what this system looks like to benefit everybody across the board. And until then, it's really important that community-based health institutions are supported and funded, because we don't have to worry about, like I said, all the things that are creating the barriers. We're here working alongside these systems to ensure that people get access to the care that they need to receive.
And from your first child up until now, have you seen any progress in the healthcare system? Or do you think it's just been a sinking ship?
I won't say that it's sinking, but it's not enough. They're not moving fast enough. They're not keeping up with the legislation. They're not keeping up with the cost of living and the economy. They're not keeping up with the fact that, particularly in our rural communities, there are no hospitals. There are no providers. Like, I get people contact us all the time to let us know that, their local OBGYN is retiring out. No one else is coming to the community because there's purposely underdevelopment in rural communities. And no one wants to talk about that because they like to try to make it a black and white thing. But that's why I said everything is rooted in racism. And people can't see it because of the talking points around that. But there's no reason, when you have a population of people who have to drive hours just to give birth, it's just very sad and tragic, and it affects all of us.
Well, thank you so much, Maya. This was definitely an educational and informational episode, or educational interview. Thank you so much for sharing your expertise and your knowledge when it comes to doulas and midwives and your organization as a whole, MAAME. I hope and pray that you expand and you touch as many lives as possible, and I'll do my part to get the word out on this. But thank you so much.
Thank you.
Thank you.
Thank you.
We made it to the end of today's episode. I certainly believe that this conversation topic was informational and educational, and I hope you feel the same way as well. Also, I hope that you became more knowledgeable and aware of the importance of having great prenatal care. Please don't forget to like, comment, and subscribe, and I'll see you in my next episode.